we start the topic of heart failure. So heart failure is not actually disease. It is the end result, or it is the sequelae of cardiac diseases and non-cardiac diseases. So it is actually a complication. Heart failure is actually a complication. It is not a separate entity. It is a complication, it is a sequelae, or it is the end result of any cardiac disease or other non-cardiac causes of heart failure. So, as the name suggests, heart failure means your heart fails. Your heart fails to function. So, what is your heart's function? Your heart's function is pumping action. The function of heart is pumping action. Heart has to pump the blood, that is called cardiac output or stroke volume, into the aorta, from aorta to systemic circulation, so as every tissue of the body will get adequate blood supply, adequate oxygen, adequate nutrition. So that is the function of your heart. So it is very, very important function of heart to act as a pump, to pump out the blood. That is the function of heart. And when your heart fails to act as a pump, to pump out the blood, that is called heart failure. Your heart failed to act as a pump. This is your normal ECG complex. P wave suggests or indicate atrial contraction. This is small q, r, s, and t. This QRS complex, this QRS, it represents ventricular systole or depolarization state. From start of P to end of R wave. Start of P to end of R wave, that is PR segment. Start of S to the end of T, this is the T wave. This from S to T, it suggests ventricular repolarization stage. It is ventricular repolarization. This is atrial contraction, this is ventricular contraction, and this is repolarization. So this is ST segment, this is T wave, and this is QT interval. So it is not, this is a normal ECG. No need to go in detail. Now the definition of heart failure. So it is actually a clinical syndrome resulting from any structural or functional cardiac defect or cardiac problem. The heart is unable to pump out sufficiently the blood to maintain blood flow to meet the body's need. That means it is heart failure. So types of heart failure, there are various types of heart failure. Acute versus chronic. Acute heart failure, heart fails within a short period. Chronic heart failure means heart fails over a period of time, slowly. That is acute versus chronic. So acute heart failure is very common after massive myocardial infarction or a big heart attack, a massive heart attack. So acute heart failure can occur after massive MI because of accelerated hypertension. If your blood pressure shoots above 200, above 250, so that accelerated hypertension can cause acute heart failure. So the causes of acute heart failure after massive myocardial infarction and accelerated hypertension, as well as we discuss in rheumatic fever also. When it causes carditis, there can occur acute heart failure because of carditis. So myocarditis or carditis, because of any reason, either viral, either rheumatic, can result in acute heart failure. How to identify acute heart failure? In acute heart failure, the back pressure effects are less and the compensatory mechanisms are not activated. So in acute heart failure, you don't get swelling over lower limb. In acute heart failure, there is no peripheral edema and the blood pressure is usually maintained or sometimes increased. That is the difference in acute and chronic. Acute heart failure, usually there is no peripheral edema and blood pressure is usually maintained or acceptable. Chronic heart failure is because of chronic diseases. Chronic heart failure is because of chronic heart diseases, means your heart will become weak and weak over a period of time and then ultimately it fails. That is chronic heart failure because of chronic diseases like ischemic heart disease, rheumatic heart disease, cardiomyopathy, So diseases of the heart itself that results in chronic heart failure. So in chronic heart failure, you get edema, that is swelling over lower limb. Blood pressure can be low, that means patient can be in shock or in hypotension. So that is the difference in acute heart failure and chronic heart failure. Then second is left-sided heart failure versus right-sided heart failure. Already we discussed. Left-sided heart failure is common in systemic hypertension, and you get pulmonary edema is very predominant in left-sided heart failure. Pulmonary congestion or pulmonary edema is the characteristic feature of left-sided heart failure, which is usually common in accelerated hypertension or in systemic hypertension. Right-sided heart failure usually common secondary to lung diseases or secondary to vulvar diseases like myelostenosis. As you already see, the right-sided heart failure is common in myelostenosis. So in right-sided heart failure, you get systemic congestion. Systemic congestion means you get raised jugular venous pressure, you get congestive hepatomegaly, and you get swelling on the lower limb. So that is the difference in left-sided heart failure and right-sided heart failure. Left-sided heart failure, predominantly there is pulmonary edema and pulmonary congestion. And in right-sided heart failure, there is systemic congestion. Means increased jugular venous pressure, congestive hepatomegaly, ascites, and swelling over the lower limb. That suggests right-sided heart failure. Then systolic versus diastolic heart failure. Then high output versus low output heart failure. So many times when heart failure is there, usually the stroke volume, cardiac output is affected, and there is less stroke volume and less cardiac output. Most commonly there is low output state, which is usually common in systolic heart failure, low cardiac output and low stroke volume. But there can be a high output type of heart failure also. So in which condition you get high output in cardiac failure? So high output failures seen mainly in hyperdynamic circulation. So hyperdynamic circulation means blood has to pump a large volume of blood. Heart has to pump a large volume of blood, which heart is not able to pump out and your heart fails. That is called high output failure and the hyperdynamic circulation. Hyperdynamic circulation is common in severe anemia, beriberi, thyrotoxicosis. These are the conditions where you get hyperdynamic circulation. Increased blood volume, that is called hyperdynamic circulation. So thyrotoxicosis, beriberi, and severe anemia. These are the conditions where you get hyperdynamic circulation and high output type of heart failure. Means cardiac output is high, it is not affected or it is not low. So these are some types of heart failure: acute versus chronic, left-sided versus right-sided, systolic versus diastolic, high output versus low output. So these are some types of heart failure. Now the causes of heart failure. No doubt, diseases of heart itself. So ischemic heart disease, rheumatic heart disease, vulvar heart diseases, congenital heart diseases, cardiomyopathies, pericardial effusion means fluid collection in the pericardial cavity, which compress your heart, massive pericardial effusion, myocarditis. All these are the causes of heart failure, means diseases of the heart itself. Then heart failure secondary to lung diseases. Already we discussed in respiratory system. That cor pulmonale secondary to lung diseases. So it is the right-sided heart failure secondary to lung diseases is called cor pulmonale. We already discussing respiratory system. So lung diseases like COPD, asthma, interstitial lung disease, all these diseases in long-standing cases over a period of time can cause pulmonary hypertension, and pulmonary hypertension cause right-sided heart failure, which is called as cor pulmonale. So heart failure secondary to lung diseases. Then hyperdynamic circulation, as already we discussed, anemia, thyrotoxicosis, beriberi. This is the hyperdynamic circulation which cause high output type of heart failure and accelerated hypertension. So these are the other causes. Then certain drugs. Certain drugs also responsible for heart failure, mainly the chemotherapeutic drug. Chemotherapeutic drug means drugs which are using malignancies, anti-malignant drugs. So certain anti-malignant drugs can cause heart failure. So that is the etiology of heart failure. Now what is pathophysiology, or what happens when your heart fails? or what are the changes occurring in your body because of heart failure. So when heart fails to act as a pump, your heart fails if it affects stroke volume, cardiac output. Means there is decreased cardiac output, decreased stroke volume. If cardiac output is decreased, that means the tissues of the body will get less blood supply. Tissues of body will get less blood supply. They suffer from poor nutrition supply and poor oxygen supply. So it will affect every tissue of the body. It will affect every tissue of the body. So whenever your heart fails, cardiac output is decreased. First, the vital organs are affected. Means like brain, kidney, liver. These are the vital organs which are affected. So in order to avoid the damage to vital organs or damage to any tissue of the body, some compensatory mechanism get activated in your body. Some compensatory mechanism get activated in your body so as and they try to maintain or increase cardiac output of the heart. The role of this compensatory mechanism is to increase cardiac output so as every tissue will get proper blood supply. Every tissue will get adequately perfused, good oxygen and good nutrition supply. So the aim of compensatory mechanism is to increase cardiac output, to maintain tissue perfusion, and to prevent the damage to the vital organs. Or many times, another purpose of activation of this compensatory mechanism is redistribution of blood. Means blood is redistributed from other tissues of the body to vital organs. Because to prevent damage to vital organ is more important. So blood is distributed to vital organs. So that is the aim of compensatory mechanisms. Which are these compensatory mechanisms which get activated when your heart fails? So when heart failure occurs, when there is decreased cardiac output, there are two main compensatory mechanisms. One is activation of sympathetic nervous system. No doubt, whenever body is under stress, any type of stress, whenever body is under stress, any type of stress, activation of sympathetic nervous system is there 100%. Sympathetic nervous system always get activated whenever body is under stress because it is the function of sympathetic nervous system as a stress response, to give response to stress. So activation of sympathetic nervous system. So what happens when sympathetic nervous system get activated? Sympathetic nervous system activation results in increased heart rate, that is tachycardia and vasoconstriction, arterial as well as venous vasoconstriction. So that is the role of activation of sympathetic nervous system, tachycardia and vasoconstriction. So this increased heart rate and vasoconstriction, the aim is to increase cardiac output, to increase blood pressure of the body, so that the tissues get well perfused or tissues get blood supply. Now, which is the second compensatory mechanism which get activated? The important compensatory mechanism is RAS system. RAAS. RAS system means renin, angiotensin, aldosterone system. It is renin, angiotensin, aldosterone activation. That is called RAS system. RAAS. Activation of RAS system. So when cardiac output is decreased, stroke volume is decreased, in heart failure, there will be decreased renal blood flow. There will be decreased renal blood flow. This decreased renal blood flow activates renin. This activation of renin causes angiotensinogen to convert into angiotensin 1. This step occurs in the liver. This angiotensinogen to angiotensin 1, this step occurs in liver under the influence of renin. Then angiotensin 1 is converted to angiotensin 2 in lung. Because in lung, there present angiotensin converting enzyme. There is a angiotensin converting enzyme present in lung, so angiotensin 1 is converted to angiotensin 2. And as well as there will be activation of aldosterone secretion. This kidney also causes to increase aldosterone secretion. Now, what is the function of aldosterone and angiotensin 2? There will be increased angiotensin 2 level, increased aldosterone level. So, the function of angiotensin 2 is to cause vasoconstriction. Angiotensin 2 causes vasoconstriction, increased blood pressure, so that the vital organ get adequately perfused. If blood pressure is increased because of vasoconstriction, their aim is to perfuse the vital organs, to perfuse the every tissue of the body. They should get adequate blood supply. And the function of aldosterone is sodium and water retention. So this sodium and water retention in the body is responsible for edema. This sodium water retention is responsible for edema. So activation of sympathetic nervous system, activation of RAS system. So role of aldosterone, role of angiotensin 2, and the role of sympathetic nervous system. So they act together. These two systems act together. Their aim is to increase cardiac output, to prevent damage to vital organs, and every tissue should get adequately perfused. Should get adequately perfused. That is the aim of compensatory mechanism. See, decrease cardiac output, activation of sympathetic nervous system, activation of RAS system, as well as there is increased antidiuretic hormone also, that is ADH. There is increased antidiuretic hormone. The function of antidiuretic hormone is to increase circulatory volume. It will not allow diuresis. So increased antidiuretic hormone will increase circulatory volume, and that will increase preload. Circulatory volume means to increase preload. So activation of sympathetic nervous system causes tachycardia and vasoconstriction. Vasoconstriction is caused by both sympathetic nervous system as well as by angiotensin 2. As well as sympathetic nervous system causes increased contractility. So there will be increased preload, increased stroke volume, increased cardiac output, as well as increased afterload. Afterload means when your arteries get contracted or when there is vasoconstriction of arterial bed. When there is vasoconstriction of arterial bed, it is called increased afterload. And increased preload means when the venous return to the right side of the heart is increased. If there is increased venous return on the right side of heart, that is called as preload. That is called as preload. So sodium water retention as well as role of antidiuretic hormone results in increased preload. Means the water is retained in your body. Water is retained in your body. This retained water, that means there will be increased venous return to the heart. This is called as increased preload. This is called as increased preload. And increased afterload means whenever there is vasoconstriction of arterial blood bed. Vasoconstriction of arterial bed means when arteries get contracted. That is called as increased peripheral vascular resistance, which is also called as increased peripheral vascular resistance. So if there occurs vasoconstriction, your heart has to pump against more resistance. Your heart has to pump against more resistance. And if preload is increased, that means your heart has to pump out more blood. Increased preload means your heart has to pump out more blood, and this increased preload aggravate your pulmonary edema. If venous return to right side of the heart is increased, already your right-sided heart is filled. So if venous return is increased, that means you are increasing load on right side of the heart. So it will result in increased pulmonary congestion. It results in, or it aggravates your pulmonary edema. Increased preload aggravate your pulmonary edema. See, increased preload aggravate your pulmonary edema. So increased preload, increased stroke volume, increased cardiac output, increased afterload, and because of tachycardia, because of contractility, all these will increase oxygen demand of the heart. Oxygen consumption of heart is increased. If oxygen demand by the heart is increased, because the work on the heart is increased. In this condition, or this compensatory mechanism cause your heart to work more and more. They tell your heart to work more and more. But already your heart is weak, already your heart is failed. And if you tell that heart to work more and more, then the oxygen demand of the heart is increased. And if it is not fulfilled by the coronaries, then your heart again become weak. That means it aggravates your heart failure. And your ultimately heart fails and there will occur decreased cardiac output. So this is RAS system, renin secretion, angiotensin 1, angiotensin 2, and aldosterone secretion. So all these compensatory mechanisms, they are beneficial in early stages only. These compensatory mechanisms are beneficial in early stages only, so that your vital organ damage will be prevented and your body's tissue will get well perfused. But these are beneficial only in early stages. What happens? The increasing load on the failing heart. Over a period of time, the increasing the load on failing heart, your heart will become more and more weak. Your heart is already weak. You can't do more work. And if you tell your heart to do more work, your heart become again weak, and the heart failure will aggravate. The heart failure will aggravate. So these compensatory mechanisms, though they are beneficial in early stages, actually they are detrimental or they aggravate your heart failure later on. These compensatory mechanisms will aggravate or they are detrimental to heart and they aggravate heart failure over a period of time. So initially though they are beneficial, later on they aggravate heart failure or they will not be beneficial. See the compensatory mechanisms: activation of RAS system, activation of sympathetic nervous system, antidiuretic hormones which increase activation of the sympathetic nervous system, tachycardia, contractility, sodium water retention, all these results in congestive heart failure. Now, signs and symptoms in heart failure. No doubt, when heart fails, what happens? Though it is heart fails, so already we discussed the back pressure effects. Already we discussed which are the back pressure effects in rheumatic heart diseases. So what are the back pressure effects when your heart fails to act as a pump? Your heart is not able to pump out the blood. If your heart is not able to pump out the blood, what will happen? The pressure in the ventricle increases. Later on, the pressure in the atria increases. Later on, the pressure in the pulmonary circulation increases. If the hydrostatic pressure in pulmonary vessels increase, if hydrostatic pressure in pulmonary vessels increase, this will result in pulmonary edema. This will result in pulmonary edema because increased hydrostatic pressure causes to fluid come out from blood vessel into interstitial spaces. Increased hydrostatic pressure causes the fluid to come out from the capillaries into interstitial spaces initially. Means initially there is interstitial edema. Later on, fluid in the alveoli, that means alveolar edema, and which is called as frank pulmonary edema. So the back pressure effect results in pulmonary congestion, pulmonary edema. So this pulmonary edema or this back pressure effects, pulmonary congestion causes hypoxia. If there is fluid in interstitial spaces and in the alveoli of the lung, what will happen? Your blood will not get adequately oxygenated. The oxygenation of blood is hampered. If there is fluid in alveoli and fluid in interstitial spaces, what happens? There will occur hypoxia. The blood is not adequately oxygenated because the oxygenation occur at this level, at alveolo-capillary level. Oxygenation occur at alveolo-capillary level. Oxygen is added, CO2 is washed out. But if already there is fluid, the blood will not be properly oxygenated. There will occur hypoxia, and this hypoxia results in breathlessness. Breathlessness is the main symptom of heart failure, or one of the important cause of heart breathlessness. The very important cause is heart failure. So this is the main symptom of heart failure, breathlessness. Patient will complaining of breathlessness. Presence of orthopnea, presence of PND. Already we discussed in practical. Orthopnea means breathlessness in lying down position or in supine position. And PND is paroxysmal nocturnal dyspnea, means breathlessness occur at night. Patient wake up from the sleep. He desires to have a fresh air. He open windows, he open doors, and he desires to have a fresh air. So this breathlessness at night is called PND, paroxysmal nocturnal dyspnea. So breathlessness, presence of orthopnea, presence of PND is characteristic symptom of heart failure. So PND is very common in left heart failure or left ventricular failure. So the cause of PND, if you ask in practical, what is the cause of PND? The cause of PND is left ventricular failure. So why patient is breathless at night? Because patient at night during sleep is in supine position, or in supine position there will be increased venous return. The venous return to heart is increased in supine position. If you stand up, then because of gravity, the venous return will be less towards the heart. But in supine position, the venous return towards the heart is increased. And second mechanism, your sleep centers are disturbed at night, depressed at night. Your respiratory center is depressed at night. That is the another mechanism. So the main mechanism is increased venous return to heart, which aggravate pulmonary congestion. And second, the respiratory center is quite depressed at night during sleep. So these are the two mechanisms responsible for PND, paroxysmal nocturnal dyspnea, very characteristically seen in left ventricular failure or left-sided heart failure. So breathlessness is the main symptom, presence of orthopnea, presence of PND. Then swelling over legs, patient usually presented with anasarca, swelling over legs, fatigue. This fatigue, this decreased effort tolerance mainly because of decreased cardiac output, and the tissue is not properly perfused or tissue will not get adequate blood supply. So patient complaining of fatigue, decreased effort tolerance, patient feel tired, patient feel easily tired. That is called fatigue and decreased effort tolerance. Then oliguria, decreased urine output because the kidneys will not get proper blood supply. So it results in oliguria. Distension of abdomen, that is the fluid collection in peritoneal cavity, presence of ascites, and abdominal discomfort and sometimes vomiting. This abdominal discomfort and vomiting is because of congestive hepatomegaly. This is because of congestive hepatomegaly. So the back pressure effects are pulmonary edema. Then this pulmonary edema later results in right-sided heart failure. So when left-sided plus right-sided heart failure occur, it is called congestive cardiac failure. Left-sided plus right-sided heart fails, then it is called congestive cardiac failure. So when right-sided heart fails, there will occur increased jugular venous pressure. There will occur enlargement of the liver because of increased congestion of the liver. That is called as congestive hepatomegaly. This congestive hepatomegaly, the liver is tender, patient complaining of abdominal pain, and because of enlargement of liver, because of increased congestion, patient is complaining of vomiting also. So congestive hepatomegaly present with abdominal pain and vomiting. So patient of cardiac failure can sometimes complain abdominal discomfort and vomiting because of congestive hepatomegaly. And second, swelling over legs, which is the common complaint of patient. Breathlessness and swelling over leg. These are the two common complaints in patient of heart failure. Breathlessness and swelling over lower leg. That is edema. So one of the important cause of edema is congestive cardiac failure. One of the important cause of breathlessness is congestive cardiac failure. Now there are grades of breathlessness. These are NYHA grade of breathlessness, means New York Heart Association. These grades of breathlessness are different. These are for cardiac patient. These are for cardiac patient. This is New York Heart Association classification of breathlessness. So it is breathlessness because of heart disease, means it is cardiac breathlessness. It is cardiac breathlessness, grade 1, 2, 3, 4. So what is grade 1? There is no limitation of physical activity. No limitation of physical activity. Ordinary physical activity does not cause breathlessness, fatigue, or palpitation. Grade 2, there is slight limitation to physical activity. This patient is comfortable at rest, but ordinary physical activity can result in breathlessness, fatigue, and palpitation. So there is slight limitation to ordinary physical activity. Marked limitation to physical activity. Patient is comfortable at rest, no doubt, but less than ordinary activity, even less than ordinary physical activity, can result in undue breathlessness, fatigue, and palpitation. And grade 4 is patient is not able to carry out any physical activity without discomfort. Patient is symptomatic even at rest. Patient is breathless at rest. Patient cannot do any physical activity without discomfort. If any physical activity is undertaken, discomfort will be increased. that is grade 4. So this is the position of grade 4. So grade 1, 2, 3, 4. This is called as NYHA classification of breathlessness because of cardiac problem. New York Heart Association. Many times can be asked in Viva NYHA classification of breathlessness. So no limitation to physical activity. Ordinary physical activity does not cause breathlessness, fatigue and palpitation. There is slight limitation. Patient is comfortable at rest, but ordinary physical activity can cause breathlessness, fatigue and palpitation. Then there is marked limitation. This patient is comfortable at rest, but less than ordinary physical activity results in undue breathlessness, fatigue and palpitation. And patient is not able to carry out any physical activity without discomfort. Patient is symptomatic at rest, and any physical activity will increase the discomfort. Now the signs. We will discuss the remaining part in next lecture. Signs, investigations and management of cardiac failure. See the signs on general examination. No doubt, increased pulse rate because of sympathetic activity. Blood pressure can be high, can be low, can be normal depending on etiology of the heart failure. Increased respiratory rate. No doubt, patient is breathless, so respiratory rate is increased. You get presence of edema on general examination and increased jugular venous pressure. So these are the positive findings on general examination in a patient of heart failure. Positive findings: increased pulse rate, blood pressure can be high, can be low, can be normal depending on etiology. Increased respiratory rate, presence of edema, and increased jugular venous pressure. Cardiovascular examination. Cardiovascular examination, depending on etiology. If etiology is rheumatic heart disease, you can get murmur, you can get presence of thrill. If the etiology is rheumatic heart disease. But common to all is presence of S3 and S4. As already we discussed, presence of S3 and S4 means third heart sound, fourth heart sound is called gallop rhythm, which is very characteristic of heart failure. The presence of S3 means third heart sound. It always suggests that patient is cardiac failure. So this is very characteristic of heart failure, presence of third heart sound called as gallop rhythm. In respiratory system, you get fine crepitations at the basis of lung. This is because of pulmonary edema and because of pulmonary congestion. On per abdomen, what you get? Ascites means distension of abdomen. This is because of ascites. This distension is because of ascites. Ascites means fluid collection in peritoneal cavity. Congestive cardiac failure is actually a state of increased hydrostatic pressure. It is actually a state of increased hydrostatic pressure. Increased hydrostatic pressure in pulmonary circulation, increased hydrostatic pressure in the system. So that results in pulmonary edema, that results in edema over the lower limb, that results in presence of fluid in peritoneal cavity. That results in presence of fluid in pleural space also. So pleural effusion also can occur in congestive cardiac failure. So congestive cardiac failure is actually a state of increased hydrostatic pressure. Increased hydrostatic pressure in the pulmonary vessels results in pulmonary edema, presence of pleural effusion. So transitive type of pleural effusion means fluid collection in pleural space will also occur in congestive cardiac failure. Increased hydrostatic pressure results in fluid in peritoneal cavity, that is ascites, which is again a transitive type of collection. Increased hydrostatic pressure in peripheral vessels results in edema over the lower limb. So pulmonary edema, pleural effusion, ascites, and swelling over the lower limbs. So all these are because of increased hydrostatic pressure, and all this is seen in congestive cardiac failure. So because of this congestion in the lung, it results in fine crepitations or auscultation if you keep stethoscope over the lung field. In per abdomen, you get ascites and enlargement of liver, which is also tender. This enlarged liver is palpable and tender. This is called congestive hepatinitis. So signs on general examination: cardiovascular system examination, respiratory system examination, and abdominal system examination.